Look, every single case of chronic pain has a component of biological, a component of psychological, and a social component to the perception of pain, the propagation of pain, all those things. And this biopsychosocial model is an appropriate model for better understanding chronic pain. Now, what I think a lot of people and practitioners miss is that each person is going to have a unique variation of that. Some people might be 90% biological, 10% psychosocial. Other people might be 90% psychosocial and 10% biological. And a good provider is going to help to try to understand when it is which of those things, because there are different treatments that are appropriate for different components of that. Our treatments here with regenerative injection therapies do not work in patients who have a very large psychosocial component to their pain. Putting a needle into a facet joint in the low back for somebody who has back pain, even if they have, let's say a little bit of fluid in the facet joint on an MRI, and when we do provocative testing for the facet joint, we recreate their pain, all those things. But if 90% of their pain is driven by psychosocial factors and not the biological tissue, then these therapies are not going to work very well. And I think that's one of the reasons that, even the clinics who do really good diagnostic workups will still see failures from time to time. It's not appropriately understanding, okay, this patient was more on the psychosocial side and probably needed a little bit different therapy than injections. I think conversely, there's a lot of providers out there who just use a psychosocial approach to their, whether it's physical therapy, whether it's to counseling, like whatever approach they have for chronic pain, they try to just fit everybody into this box of, well, all pain has a psychosocial component, therefore everybody should respond to psychosocial approaches. And that unfortunately just isn't true. And so the big thing I want to drive home here is that if you are in chronic pain and you have not been seeing improvements with one type, let's say you have just really been going down the biological route and you're not seeing a ton of improvements, maybe you want to explore the psychosocial piece. Or if you've just kind of been approaching it from the psychosocial side, maybe you need to look at the biological piece. And then also understanding that, the best approaches for treating chronic pain is going to be a personalized approach. This is where algorithms fall apart. This is where the conventional medical systems approach to, okay, you have back pain, okay, you're going to do physical therapy. Okay, that didn't work, you're going to do steroid injections. Okay, that didn't work, you're going to do surgery. Also notice that a lot of that is just physical and not psychosocial. And so that's a huge missing piece from that system. And so there's a lot of layers to this. Chronic pain is complicated, it's complex, it is nuanced. And if you are suffering, sometimes the biggest thing that you can do is to work with somebody who can really give you a personalized, individualized approach that is not dictated by insurance algorithms. Have a good one.